This guy looks familiar. A diabetes rock star. A diabetes conference. What is that? Is that a diabetic Santa? The future of diabetes is now? Hey, aren't you that guy from the poster?
Well, yes, I am.
So who exactly are you and where am I?
I'm Dr. Steve Edelman, founder and director of Taking Control of Your Diabetes. And this is our production studio and office.
I've heard of you guys.
Yeah, we put on in-person conferences, virtual events. We have a huge library of edutaining videos, podcasts, newsletters, all to help people with diabetes like me and you.
Wait, so you're an endocrinologist and you have diabetes?
Yeah, I got diabetes when I was 15 years old in 1970. The dark ages, Mary. The doctor told my mother that I would probably die of complications in 20 years. And he didn't know I was listening, but I was. And I wanted to prove him wrong. I studied to become an endocrinologist. I started Taking Control of Your Diabetes, really whose mission is to educate and motivate people with diabetes to live a longer, happier, and healthy life. It's all about bringing the important messages about living a long and healthy life directly to the people most affected by it, people like you and I.
Perfect. I've always had so many questions about my diabetes and I've always wanted to sit down and have coffee with an endo.
Sounds great. Let's sit down and have a chat. Okay, Mary, ask me any question you want, no matter how complicated or even if it's an embarrassing question.
All right, what about that espresso martini? So how does alcohol and caffeine affect your blood sugar?
Well, the alcohol itself, vodka, which is free, like any other hard alcohol, like whiskey, tequila, but if you put in Bailey's and some of the coffee liqueurs, it can get sweet and raise your blood sugar. Now, caffeine, it typically won't affect your blood sugars, but it may keep you up all night.
All right, and what about sex?
Well, you know what, Mary, I've got to run. I have a flight to catch, but Dr. Manasi is going to be here. She's an excellent endocrinologist, and I think she'll be able to answer that question.
Did I hear my name? Hi, Mary.
Hi.
I'm Manasi.
So good to meet you.
So nice to meet you. Oh, Steve leaving me his leftovers, as usual. I heard we have a lot to talk about.
We do.
I'm a pediatric endocrinologist. I think you have some questions for me.
I have a lot.
Let's go.
All right. So what's your history with diabetes? How did you get started with TCOYD?
Well, I actually met them about 5 years ago when I moved to San Diego. I was working on cell therapy at a company called ViaCyte, and Jeremy was one of the investigators. I got to know him, and then I got to know about TCOYD, and I was immediately hooked. I always wanted a platform like this for my patients, so I was really excited just to find this home here. And again, I worked on cell therapy. It's very important to me. I continue to work in that field, and this research has been kind of part of my career path for a really long time.
Wow. You know, it can be so awkward to talk to my doctor about any of these things.
I totally get it. I used to see teens in my clinic, and we used to talk about things like this. So I'm really, really glad we were able to connect.
Yes.
Let's go chat about it.
Let's do it. Let's get comfy.
Amazing. Got a pillow, got a drink.
Yeah.
Okay.
All right. Let's get into some questions.
All right, what you got for me?
Okay. Well, I think we should start with sex. I feel
Okay.
like there's a lot of questions around sex.
As Steve ran out of the building.
Yes, he
we'll address
did.
this. Okay.
Yeah.
What questions do you have for me?
I mean, what tips do you have with somebody, you know, that has diabetes, has never had sex? What would be the most important things to know?
So I like to, well, I'm going to go over a few things. I think before and after, I don't really want to, unless you want to share, if anybody wants to share, middle, but what's important is how you set it up for yourself.
Right.
And there's a lot out there, a lot of different types of advice you can get from physicians on what protections to use, but the most important protection you can have is preparation. And so you have to think of sex like exercise, most likely.
Right, right, yeah.
So it is exercise, right? So what are the things that you would do typically if you were exercising?
Lower my insulin, you know, my basal rate maybe. Maybe have a snack before, carb, maybe some protein to hold me for a bit. Yeah.
So
Yeah.
if you were about to go, say, on a treadmill for a light run, what would
Yeah.
your blood sugars be? What would you aim for before the run?
For me, I'd probably be around like 7 or 8, maybe just a little bit up, because I know I'll probably lower down a bit, especially if I'm doing some cardio.
Exactly.
So, yeah.
So that's how I would frame it. So think
Yeah.
of sex as cardio.
Yeah.
And what would you normally do before you would exercise? Keep your blood glucose there.
Yeah.
And do the same things. If you need to lower your basal rates,
Yeah.
you need to have a snack. And then, it depends on what you're wearing, right? So if you have a CGM on, you have a pump on with tubing,
Yes.
or a tubeless pump, depending on that, you should have that conversation with your partner, right? Like, I have these things on my body. Some prefer to remove everything, which I understand, right?
Yeah.
So I'm not going to tell you, keep all your devices on, you have to, because this is a moment of pleasure.
Yeah.
And you don't want to be reminded of all these things all the time. But I think it's how you prepare beforehand, know what you're going in with your blood glucose, and have a plan after. Are you checking your blood glucose right after? And how often are you checking it? Now, there are some that will say you got to check it like 30 minutes, every 30 minutes. Well, if you're in the middle of it, you're probably not going to be bothered about checking your blood glucose, right? And so what you want to make sure is you check before, you're prepared as if it's exercise. And then what I would say is during, if you have these devices on, remember where they are. Right?
You don't want to rip
because
them
you don't want to rip them
Yeah.
off. Depends on what you're doing, where they're placed. So that's
Yeah.
really important to kind of keep in the back of your mind. And then after, you want to enjoy the experience, but also you want to be mindful about what's going to happen with your blood glucose. So there's a couple of things that can happen. As with type 1 diabetes, it's always variable, right? So it's either you will probably go low a little bit later, but remember, it's adrenaline. Adrenaline can bring your blood glucose up.
Right.
So that's always temporary, and
Right.
usually you'll still go low later.
Right.
But to keep that in mind. So with exercise, same thing. It's adrenaline too, depending
Yeah.
on what you're doing. So you may have a slight bump, but eventually over time it may go lower.
Yeah.
So you want to make sure even after, if you get a chance, and if you had this conversation with your partner, maybe you haven't, take your blood glucose at some point soon after.
Yeah.
Right? After you rested or whatever it is, try to figure out how to take your blood glucose just to know where you're trending. And maybe you need another snack.
Yeah.
And that's okay too.
Yeah. An excuse to have some more snacks.
I mean, who doesn't want a little snack after?
Yeah.
But-
Okay, that's some good advice.
Yeah.
I like that. Yeah.
And you got to remember, you got to live your life.
Yeah.
And so just being prepared before and after, that's the most important key pieces.
Right. Yeah. Okay. Okay, I have another question.
Okay.
One thing that my doctor never talked about was, what if you wanted to go on birth control or some kind of, form of that? Like, does that affect your diabetes or your blood sugars in any ways too?
Birth control doesn't have sugar, right? It's it's the placebo pill, so it's the you have the blue pills for the most of the month, right? If
Right.
it's not an injection, if it's you have pills that you're taking, and then the smaller pills that you take on your off week, they may have some form of glucose in there. You don't have to take those, but it's so minimal that it shouldn't affect it at all,
Okay.
right? But it's interesting because periods.
Yes.
That's what's gonna be more apparent to you in blood glucose. I'm sure you've seen that too.
It's the trickiest part of managing my diabetes.
It is. It's
Yeah.
the week before, leading
Yeah.
up to it. It's called the luteal phase. It is always the worst.
Yeah.
I feel like you usually get a spike and then it's variable.
Yes,
It's just, you can't do
exactly.
anything to actually bring it down.
Yeah.
Again, my mantra for type 1 diabetes in general is preparation
Yeah.
and understanding what your blood sugars are. And you may never fully understand it, but at least
Yeah.
you're prepared
Yeah.
that you know a week before. So you track your periods first,
Yeah.
and then you know that week before it's always variable. And be prepared for that.
Yeah.
It's mostly about the mental battle too, just knowing that, okay, it's going to be up and down this
Yeah.
whole time. And no matter what I do, I can only do my best.
Yeah, exactly. Well, you've already got your hormones with that going, crazy with your period, and then your blood sugar is going up and down. Is,
Yeah.
affecting your mood in every way too. So
It always
it's
does.
just,
Yeah.
it's a battle mentally and physically.
It is.
So,
It
yeah.
is. And just knowing that it's going to happen that week will help you just
Yeah.
prepare yourself a little bit more.
Yeah.
Be it if you need to have more thoughtful snacks that week, if you need to be monitoring a little bit closely,
Yeah.
more than usual.
Yeah.
But being prepared, whatever that means for you.
Yeah. No, I like that.
And one thing I was just thinking about too, because going to circle back to sex, because this is one thing that I have been asked,
Yeah.
and people don't actually think about it. So lubrication,
Right.
some can have glucose in it.
Didn't know that.
Yeah, it can be sugary, and depending on the purpose.
Yeah.
But that can actually cause an increased rate of yeast infections for women. And so, especially if you have type 1 diabetes, you already have an increased risk. And now you add lubrication, which
Yeah.
has sugar that you're feeding the bacteria.
Right.
You're going to have more likely chance of, or any of the fungus that grows there.
Yeah.
It'll be increased.
Yeah.
So you really want to be mindful of that.
Yeah.
It's not your blood sugar. It's totally different, but it's
Yeah.
the risk of infection. And it's funny how no one thinks about it.
No.
And then you're like, why did I get a yeast infection after this? And why do I keep getting them?
I know.
So think about lubrication.
Yeah.
That's what I would say.
Smart. Would have never thought about that.
I know, that's why I'm here.
Yeah, exactly. Perfect. What would be the best way for any of your patients to approach you with any of these awkward questions? Because they are awkward, right?
They are, and it's hard.
Yeah.
It's hard, right? Don't know the timing. So to find the right timing, an organic way would be that when you're doing a physical exam, right? And so usually if you're with a parent, the parent will be asked to step outside. So that's the right time to say, okay, before we do the exam, we really have some questions for you.
Yeah.
Best way to be direct, be open. The doctors want to be beneficial and helpful, and sometimes they have a hard time understanding where you are in terms of sex or drinking or drugs, whatever it is.
Yeah.
And they want to help you, right? And so at the end of the day, be direct and find those pockets of time. And there's also times where even if you're about to end your clinic visit and you're about to walk in and say, I just have one more question. Do you think I can talk to you privately?
Smart.
And especially if you're worried about a parent being there.
Yeah.
And they'll be happy to step back in and talk to you.
Okay, that's awesome advice.
Yeah, of course.
Well, thanks, Manasi.
I'm so happy we got to talk.
I know, same. We have a ton of videos for all of you guys. We're doing a whole series. We're going to cover topics of sex, drug, alcohol, pretty much anything that can be awkward to talk to your doctor about. So follow along, check out the rest of the videos that we're going to be putting up, and yeah, it'll be a fun ride.
Yes, it will.
Yeah, awesome. Thanks again.
Of course.
Okay.
Cheers.
Cheers.